Welcome to People. I'm Micah Mater. All week, Health Secretary Robert Kennedy Jr. testified before Congress, oftentimes with heated exchanges from members questioning him on policies many in the medical community consider controversial. Here he is with Representative Summer Lee from Pennsylvania.
Do you have an idea of how we could solve the black maternal mortality crisis if we can't say black?
President Trump is trying to end division in this country, not division.
Not eviction.
During the last 4 years. That's what DEI did. It divided people. It polarized people.
No. We're not talking about eviction. We're talking about healthcare.
I'm calling about DEI.
We're talking about healthcare.
Yeah,
disparities. So what we're asking is if you attack DE&I and then we have a crisis that impacts one population over another, but you cannot direct specific spending or research or interventions to that population, how do you solve the problem?
As black maternal health continues to top the headlines, the doctors are in. Dr. Ngozi Ezike from President and CEO of Sinai Chicago, and Dr. Jeffrey Sterling, author and president and CEO of Sterling Initiatives. Thanks for coming in, guys. Let's just jump right in on the maternal health issue. We know that black mothers die 3 times more than other mothers during childbirth. Why is the government not focusing on that, do you think? Or do you think they should be focusing more on the maternal health of black women, which is what they were talking about?
Yeah. This is a huge issue. This is a huge issue. I know in my former role as the director of IDPH, we kind of led the country in really trying to look at these stats, doing reviews on every single death that happened in the state of Illinois. What's really shocking is that after reviewing every one of these deaths that occurred, seeing that we had rates 3-4 times greater in African American women than their white counterparts, we also saw that a lot of these deaths were preventable. And so really trying to identify what those causes were and try to go back and change some of the processes that occur so that we don't have maternal mortality rates that mimic those in developing countries. Because right now, that's what it looks like for African American women. So
which
this
is a shame in the United States of America. How has DEI, the elimination of DEI, affected black maternal health?
So I've had this conversation all around the world, and basically if you're involved in system design, and this feeds back into the conversation with the secretary, system design usually is you're going to do the greatest good for the greatest number of the population, and or you're going to make sure that you stamp out disparities where they exist. The position that's being verbalized there is that we are being blind to the fact that healthcare disparities exist. The caveat or the add to what you said is that black women just don't have a 3 or 4 times higher rate. They have that rate regardless of income or educational level. So that means that there are social determinants of health, case by case, that need to be put in place. You need to put the right infrastructure in place to produce optimal outcomes. And until and unless we make a commitment to do that and stop bastardizing the conversation by calling it DEI, these preventable cases become predictable and they manifest in unnecessary deaths.
You talk about whoever the person is, regardless of income. We remember Serena Williams had some issues when she was giving birth. But we know what the problem is. How do we fix the problem?
I think we have to call another important factor out, because when you take out education and income, then a lot of those social determinants might not be the issue. We've looked at those cases definitively, like there is bias, whether it's implicit, subconscious. There are some factors that happen within these interactions.
Or the lack of female doctors, African American doctors, things like that.
And so we really have to address that as well.
You may be surprised, some of the listeners may not know this, but some people may be familiar with what's called an omnibus bill when it goes through the legislature. There's a thing on the federal level called the momnibus bill.
Really?
And it's an effort to actually deal with all of the things that we're talking about, the social determinants of health, the structural racism, the lack of access, the cost deterrence. There needs to be an infrastructure built. You have to start from ground zero in order to get the outcomes you want.
Let's talk about radiologists being replaced by AI. Everything's being replaced by AI. I thought at least the healthcare system, or that would not be affected by AI, but it is?
The head of the New York Health and Hospital System, which is the largest healthcare system in the country, actually said he's ready right now to replace radiologists with AI.
So is this a good thing?
Depends. AI is going to be inevitable. It's not if, it's how you implement this. And there's some context that's absolutely necessary for this. I'm awed that I'm sitting here with this for this conversation, because this is a conversation that her system is actually going to have to deal with as well. But the bottom line is that the purview of this conversation is either going to be a safety conversation or it's going to be a cost conversation. That particular CEO was looking at it in the context of saving money.
Well,
Now,
I think that's what AI is doing, saving money.
The point of the matter is that people can die if this is applied incorrectly, and you just need to have those checks and balances in place. This could be a wonderful thing if it's used as a screening examination, and you have physicians that serve as backup. Remember, we've had these same conversations when physician assistants were put in place, nurse practitioners.
But those were human beings. We're talking about
exactly. That's where I'm going with it, because I'm saying
it's a tool. We're embracing AI. We have AI tools that we're using in radiology, but it's working with human radiologists. And so understanding that, first of all, there's a shortage. There's a shortage of doctors. And so you want to be able to use a tool that will allow the radiologist to work at the top of their level, that will be able to spend more time directly with patients. And some of the rote stuff can probably absolutely benefit by having, the help of technology with oversight, obviously, and finalization by docs.
Sounds like
augment.
Yeah, you guys don't mind mixing the two together,
Absolutely
but one or the other.
The word can't be replaced. It has to be augment.
Okay, let's talk about STI Awareness Month. There's always a month for something. This is STI Awareness Month and also Autism Awareness Month. But talk quickly about STI.
So STIs are super prevalent.
Yeah.
They are very prevalent, but they're also very treatable.
Well, tell folks STIs are not STD. That's the old STD.
Yeah. Well, sexually transmitted infections, it actually just replaces the moniker that we used before. But it's to explain that it is infectious. It can be spread, and so it's very important that first that we educate people about what they are, and then we tell people how to prevent them.
And don't be afraid if you have one to go in.
Well, screen, get tested. Sometimes they're completely silent. You have no idea that you might be infected. So you have to have routine screening and then get early treatment. Because again, most of these are very, very treatable.
You and I talked about why they changed the name from STD to STI. Why?
Because it expands beyond just infections. The infections are how you start. The diseases are how they manifest. But they don't necessarily have to become diseases if you begin. See, if people want to have casual sex, then they should be willing to have casual conversations. It's not a stigma. It's not an admission. This is health. Go get tested, go get treated if necessary, because if not, then you have infertility, you have pregnancy complications, there's so chronic pelvic pain, there's so many things that can be avoided. Exactly. So we need to diffuse the notion that, oh my God, this is a whisper campaign and we can't talk about it. And
well, it took a while before we could say vagina and penis. I mean, people are having problems with that. Okay, so let's get to it, right? Let's talk about Alcohol Awareness Month, because I know this is near and dear to your heart.
Yeah. We always talking about mental health. I think it's also stress awareness month. There's a lot of
it's everything month. It all goes together.
And so we know that a lot of people tend to look to alcohol and other substances
relieve stress,
to deal with stress and to cope, and that can get us down a spiral of maladaptive responses. We're very proud to have at Sinai our Center for Substance Recovery, because we know that there are a lot of people who are having challenges with substances, and so we want to have a beautiful wellness space to be able to help people with these challenges, because there is treatment for this too. And so it's about getting over the stigma, identifying
and it is a
the
disease.
Problem.
We need to say it is a disease,
we do
alcoholism.
have to acknowledge that.
And you talk about, don't worry about the problem. Admit that you have the problem and go in and get it taken care of, right?
We should be a lot more concerned about this, because those maladaptive behaviors lead to devastating societal consequences. It destroys families. Children watch the alcoholic habits of their parents. It destroys workplace efficiency again and again. So there are a lot of consequences to it, but it begins with saying, how can we take care of our health, and having a knowledge at the beginning of the conversation that there's no safe amount of alcohol to intake without increasing your risk. So we have to begin with that. It increases heart disease, increases cancer, liver disease, accidents. This is something that is problematic, and we need to take it seriously and have conversations about it.
And that scares me when you say no amount of alcohol is good enough to get. I mean, a glass of wine every now and then is okay. But then on the other hand, they say red wine is good for you, that type of thing. So It's just everything. You got to take it in, look at it in the perspective that you're talking about, really, pretty much. And your wellness program at Sinai is really something good for folks who are interested.
We are open and ready to take care of people who want to deal with their substance issues. It's over at Holy Cross. Go to the Sinai.org website to get more information.
Thank you both. I always learn so much when you come in. Dr. Sterling's latest book, because how many do you have, like 500 of them?
10.
Oh, sorry. Myth versus Medicine, 45 claims that do not hold up. It's available now on Amazon or at jeffreysterlingmd.com. You can find details on the services and programs offered through Sinai Chicago at sinaichicago.org.